Well, hello, friends. Welcome back to this episode of Test Those Breasts. I am your host, Jamie Vaughn, and today I am so excited to have my new friend. Actually, I've known her now for maybe a year. Her name
Yeah.
is Dr. Cari Croghan. And Dr. Croghan, we call her Dr. Cari. She is a board certified emergency medicine physician with 25 plus years of experience in high stakes trauma, stroke, and cardiac care. After decades in the ER, she traded burnout for balance, launching Dr. Cari FFS, a virtual medical practice focused on hormone therapy and whole person wellness for all genders. Licensed in 15 states, her big heart and long arms have a wide reach. With a deep belief that healthcare should be clear, kind, and actually helpful, Dr. Cari blends medical expertise with a straight talk, no shame approach to aging, sexual health, and mental wellness. She's also seasoned health pro with past roles at Grand Rounds, Hims, and Concentra, helping thousands of patients make sense of confusing diagnoses and reclaim their health on their terms. Now, a keynote speaker and podcaster, she shares what most doctors won't say out loud, always with warmth, humor, and zero pretense. When she's not talking libido, hormones, or healthcare reform, you'll find her in the Sierra Mountains, juggling mom life, old dogs, and deep cleansing breaths. Well, Dr. Cari, welcome. It's so great to finally have you on my show. We've been talking about having you on for quite some time. And I just want to let my audience know that you and I met through, a grassroots organization here in our area. And I immediately took a liking to you, number one, because
Mm.
of your personality. You are a no bullshit person, and that's who I am. And I got to know you a little more and thought you need to be on my show. How are you doing today?
I'm doing pretty good, Jamie. It's so good to see you.
Well, you look gorgeous. I love your top, and I'm wearing pink today. I don't always wear pink, but it is Breast Cancer Awareness Month, which I think is total BS anyway, because every month is Breast Cancer Awareness Month. But
Amen.
October just happens to be one of my very favorite months. Number one, because it's my birthday. Number two, I love fall. Number three, I had to throw that breast cancer diagnosis into my life, so I might as well, be part of it. It's also one of the saddest, months of my life because my mother died 6 years ago, October 6th, which shame on her for doing that because it was her favorite season, my favorite season. But I keep celebrating her anyway and embracing the fall because it's so beautiful. So this is a perfect time for you to be interviewing on this show.
Perfect. Well, I have a little pink right on my breast here, so
I
I'm
see that.
celebrating too.
Did you do that on purpose?
Well, it was funny because I put it on and I was like, this is a total hand-me-down from my friend Patty. Um, and I was like, oh, this is perfect for Breast Cancer Awareness Month.
I
Yeah,
love it. I
it's
love
great.
it. I always like to say too that it's important to have Skin Cancer Awareness Month too. I constantly am having skin cancers removed from me. I just had one up here on my shoulder,
Mm.
and actually it turned
Oh,
this one turned out to be benign, but I still have to have it covered up. So it's just my little accessory for today because this is on video as well, like most people know. But listen, I really want to talk to you about a couple of things. I am actually going to Las Vegas, and I'm going to be speaking in front of patients and caregivers and people that are interested in talking about things that are uncomfortable that is related to breast cancer and really anytime. And I noticed that you have a little background on that and you don't hold back, which is great. And I'm one of those people who I just don't like to hold back. I think it's important to talk about the hard stuff, talk about elephants in the room, and with some humor and cussing at the same time, which
yes, please.
so I think that's why I resonate with you so much because you are very much out there. And I will have your social media stuff on my show notes because I want people to follow you because your videos that you put out there are extremely amazing. So I mean, you just did one recently that had everything to do with perimenopause, right? Or was it premenopause or perimenopause? Yeah.
Perimenopause, yeah.
Yeah, perimenopause, and your style is really cool. I would love to actually start by asking you to sort of tell us a little bit more about who you are, how you put your personality and your expertise out there into the public and help people advocate for themselves, and how you help patients.
Yeah, so I mean, I've always been kind of a mouthy person, and my dad especially encouraged me to just say it as it is and kind of let it fly. Um, and I think as I've aged, and especially spending a quarter century in the emergency department where everything is very irreverent, you've got to be transparent, you've got to be efficient with your words. There's really no time to be beating around the bush. You just have to get straight into it. That really, I mean, it's kind of fostered what was already natural to me to just say the thing. And so, and then just giving zero fucks through menopause. Like, I'm not here to hurt people's feelings. And I know I'm not everyone's cup of tea, but I am just going to say whatever the heck is on my mind and what is honest. And so sometimes that's helpful and sometimes it creates a little conflict, which is also okay because sometimes you can get at the deeper roots of things by really getting into the nitty gritty. So, yeah, and with telemedicine, it's, a slower pace, which I really needed after spending all that time in the emergency department where it was just go, 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 go. And now, especially with my practice, I can spend up to an hour with a patient if I want to, which is unheard of in the emergency. If I'm spending up an hour with you in the emergency department, it's because you're dying. Like that's not a good thing. So
Right.
yeah, I've really enjoyed being able to get deeper into people's patient care needs, having them divulge stuff that they usually wouldn't to a physician because we get to know each other better and have a better conversation and relaxed relationship. So they can spill the tea because I
I
sure as
love
shit am. Yes, my podcast has been very revealing lately. I've been like, whew, I'm kind of naked out here, but I guess that's what we're doing right now.
brought you into podcasting. What lured you there?
I have a group of girlfriends, and everyone is really powerful and has been in their particular professions for decades now. And so we have a ton of experience and knowledge, and most of us are irreverent and mouthy. And the stuff that we get solved by opening a bottle of wine and having a charcuterie plate is amazing. And so it's like the CPA and the attorney and the physical therapist and, the physicians of different natures. We're all moms and we're all dealing with, male partners for the most part and um, aging parents and like just getting stuff out on the table and having other people sort through your turds and be like, oh, I've dealt with this. This is who I would call about that, or this is what I would do. Several times we've been like, God, we should have just recorded that. How do other people deal with this? How do other people solve these problems that, I mean, everyone's dealing with, right? We're all humans going through our similar conditions. And so it was just funny. Like we had said that for years. And then earlier this year, my life has been going through a lot of transitions recently, and I had a partner whose job is essentially marketing, salesmanship, and launching medical small businesses, especially single and solo entrepreneurs and small groups. And he was like, you should do this. Like you should talk and people should listen to you and you say stuff as a physician that other physicians are not saying. So you're out there like educating people in a very relatable way and that should be more public. I was like, do people really want to listen to me? And he's like, yes, they do. And so I kind of started down that path. And then I was having my ex sister in law do headshots for me and I ran into her husband, and he's had a podcast for 4 years now with his buddy. And they're the dank dads, and they like smoke weed and drink twisted tea and watch sports. And like, it's hilarious. It's like the exact opposite of what I'm trying to do. But he had all the equipment in his garage. And I was like, hey, I need to come over and check that out because I don't know cameras and microphones and all that stuff. And he's like, well, what are you doing? And so I told him, and he's like, what? He said, give me an example of a reel you would do. And I was like, does your vulva look funny and you're afraid that people aren't going to want to look at it because it's all like deli ham sandwich, flippy flappy, like, and you think it doesn't meet the standard of beauty? And he's like, you cannot say things like that. And I was like, I already have, and yes, I will. And he's like, but you're a doctor and you're supposed to be all professional. And I was like, fuck that. Like, people just want to have a chat. Like, they need to sit down and, have a beer with their buddies and listen to some funny educational stuff. And so that's how it all evolved. That now I'm doing a live podcast with the two of them every other Sunday. And then I'm doing podcasting where I'm interviewing other people like yourself, other experts in their own fields. And it's just supposed to be super relaxed, and we give information, but in a real, relatable, layman's terms kind of way. So
Right. I
that's the
feel like
point.
that's such a breath of fresh air right there. And because it's definitely not boring and no one wants to listen to a boring podcast, right? So,
I mean,
what's it
you can
called?
get doctor's lectures all over the place. It's
Sure.
FFS with Dr. C.
FFS with Dr. C. And we can talk about what does that mean, Dr. Carey?
For fuck's sake.
Okay, I like it.
Because it encompasses so much. Because, I mean, we say it multiple times a day in the emergency department. Like, I can't believe I'm looking at this. I can't believe this is happening. Why didn't you come 3 years ago? Why are you here today? And so, and then as being a kid of aging parents, as being a parent of aging kids, and just dealing with life in general in your B's and 50s, there's a lot of for fuck's sake moment. So I went for it.
I like it. I like it. It's perfect. It's very catchy. Kind of like test those breasts. You can't
Yeah,
miss it, right?
that's
So,
right.
okay. So I want to ask you a little bit about what experience what you've had maybe that in your family or friends or patients or whatever with breast cancer.
Yeah, it was one of the things that I was thinking about was my aunt, my mom's sister. She was a large breasted woman. She was a bishop, reverend. I'm not religious, so I don't know the denominations, but I think she was a reverend. Anyways, and she felt a lump probably and noticed that bad things were happening, and she left it up to God. And that
Yes.
did not go well. Like, it, and she didn't tell anybody. She lived with her twin sister and her husband and some adult children, and she just hid it until it was literally like coming out of her skin and
Mm,
smelled, and that was the end of it. Um, and so I often wonder, I mean, I've seen people through the emergency department and then, in my own family who I think fear and or denial is so strong, and it's strong in all of us just depending on what the situation is. We can all like freeze deer in the headlights kind of fashion when it comes to something that seems really super scary, and cancer is really fucking scary. Uh, And so I think a lot of people will feel something, notice something, not feel right, and not say anything because they don't want the answers. I had a friend who, at a very early age in college, was dealing with some tumors, some cancerous tumors that she had. And they never even figured out where they were coming from. But like every 3 or 4 years, she had to have surgery to remove something new. She did have one in her breast, but they didn't think it was breast cancer. She had a couple of them in her brain. And so, and she was getting chemotherapy all the time, and just she's had a really tough go of it. But I had a conversation with her at one point, and she said, "Oh, I don't want to know. I don't ask for my results or anything like that. I just get the tests that they order on me, and they tell me when to show up where and if I can eat." And I was like, "How in the world have you dealt with this for decades where you just don't even want the information?" I mean, I that is not at all how I would approach anything, and that was such an interesting point of view for me, and I'm sure it's not rare. I think there are plenty of people who are just like, "Don't give me the details."
Yeah, and we're going to talk a little bit about barriers because that is one of the barriers. We talk about barriers as far as being able to get into the doctor and actually get tested and having to jump through hoops and advocate for yourself, but one of the barriers too is to get past that fear, fear of the unknown, so you don't do anything. You just like your aunt. So tell me about your aunt. How old was she? And about what decade was this?
Yeah, so she was probably in her late 60s to early 70s, I would imagine, when it was happening. I mean, who knows since she wasn't telling it. And I think she was in her mid 70s when she passed away. And that would have been the early
Okay.
90s, I believe. And there were more barriers than just her pious religiosity or whatever, to be honest. She was a pretty poor black woman in Virginia and probably didn't have great health care if she had it at all. And so I'm sure that there was probably an access to health care problem, and that discrepancy is very well known and very well documented, and it continues to plague women of color, absolutely. And so I'm sure it was like, I don't want to deal with this, and I don't know how to deal with this. And the I don't know how to deal with this probably affects the vast majority of the population because who do you go see? Who do you tell? How do you get help for this in the American healthcare system that is so broken and raggedy and almost impossible to navigate?
Yeah. And getting
It's
worse.
interesting to me because, and getting worse, absolutely. You can actually, I believe, at Renown locally, you can schedule your own mammogram. Uh, think you have a problem or if it's that time of the year and you need to go. But the system can push back on you. And how are you paying for that? You know, do you have insurance? If you don't, what is the cost of that out of your pocket? Is it worth it to do that? Are you just going to put it off for a couple of years because you didn't save up to get your mammogram? And so that barrier to even doing something if you decide that your brain is ready to do something is just like so frustrating to me. Like, if I feel a lump in my breast, I want to get that shit checked out right fucking now.
Hmm.
Um, because it's going to be in the front of my brain, right? It's just like you're looking through it all the time. And
Yeah.
it's just going to be this cloud. But I know that I don't deal with it as, you know, everybody's going to deal with it. It's in their own individual way that their mind can handle it.
Right. And, going back to your aunt happening in around the early 90s, what I have learned is that women really didn't talk about those kinds of things, whether it be, any kind of like cervical cancer or colon cancer or breast cancer, any kind of illness, they didn't really talk about it. Whereas now you have people like you and me and so many others who are outwardly talking about it out loud in the open, unapologetically. And they didn't really have that, right? So, had your aunt had some sort of education and having other people even talking about it to help her advocate for herself, things may have been different, right? So, we don't know, but I mean, it could have been a bit different. And that's why I am so focused on making sure that I reach people, especially those who've never even been diagnosed. That is one of the biggest audiences I want because I just remember when I was diagnosed, I knew a lot about breast cancer. I had had two lumpectomies, 10 years prior that were benign, but I always had my mammograms and also extra screening just because I have dense breast tissue like most women do. And so I knew a lot about it, but shit, there was so much I didn't know when I was diagnosed. I mean, so
Right.
much. And I'm still learning to this day so much more. And I know though that my biggest message to people is that, yeah, if you feel something or see something off on your breasts or in your lymph node areas or whatever, you need to make sure that you go get it checked out because the earlier it is detected, the more chance you are going to be able to survive.
That's
And
right.
I mean, luckily they caught mine at stage 2, but had I listened to my intuition and a few things that I did feel that spring, I may have been diagnosed at stage 1 instead of stage 2 when I went in to get my annual mammogram. So the idea is to get it diagnosed when it's stage 0 or 1, just to
Mhm.
put it out there. It's not easy, but it's so much easier to go through it then than it is to get it, stage 2, 3, and 4, of course. But those barriers, I have spoken to quite a few women who were, like I said, in their late 20s, early 30s, pregnant, newly married, and they had trouble getting their doctor to actually allow them to get a mammogram or any kind of screening, even though they felt something. And so we need to stop that nonsense. Like, it needs to stop. Like, doctors need to have more education. Gynecologists need to have more education, always have more education and listen to their patients. So it sounds like you're one of those doctors who listens to her patients.
I mean, I hope so. I am happy to call bullshit on all sorts of things, but what's the gamble here? Like, you're gambling with somebody's breasts and potentially their lives. There's no downside to this as far as being the provider and ordering the tests. Like, okay, so she feels something and you send them in and it looks like nothing. That didn't hurt me. It didn't hurt me at all. Like, she's reassured, the test is done. Now there's a baseline so that when she gets tested later in 5, 10, 15 years, depending on how old she is, now there's something to compare it to. I just don't feel like there's any downside to listening to somebody else's spidey senses. Unless they don't make any sense whatsoever. We should be feeling our boobs. I think that's another thing that, my aunt's generation, that probably was not happening very much. You weren't supposed to touch yourself at all. I totally disagree with that, as we know.
I do
But
too, and I have a really hard time believing that people who believe that actually didn't touch their breasts. I don't know.
somebody needs to. That's what they're there for Pete's sake. So yeah, I mean, the whole thing is like, know what your breasts feel like. Your breasts are not going to feel like anybody else's. Like, you're going to know where your little lumps and bumps are and where your little nodules are and fat globules and all this kind of stuff. So being comfortable with what the topography and geography of your own tatas are, that's the first test you have. And that way you can be like, hmm, there's this one thing that doesn't feel the same. And sometimes it is because you've had a cold or you scraped your arm, or there are reasons why you have lymph nodes or inflammation on the sides, things like that. So you keep an eye on it for a couple weeks and see if that doesn't go away, just like you would, if you get strep throat or a cold or whatever and things feel weird, you keep an eye on it. Same thing with your boobies. And so, but I don't understand what the achievement is for providers going, yeah, we're not going to order that.
Right.
I mean, the
Well, I
downside
brought
is
that.
massive.
Yeah, it is. And I brought that up because just a few weeks ago, I interviewed a gal named Coma McDowell, and she went into the doctor. And I think that she learned how to advocate for herself from an earlier situation. If you go back to the podcast to listen, it's very fascinating. But she went to her doctor. I believe she was 29. And her doctor was like, oh, no, you're too young to have breast cancer. It's probably just a cyst. So she went back home, and then she came back, and it was because it was in pain. And she came back, and her doctor kept on pushing her away every single time until finally she said, fine, we'll do a biopsy or whatever. And long story short, she would have been diagnosed probably at stage 1 or whatever at that time that she first started coming in. And by the time she got some more opinions and went further down the road, it was stage 4.
Come on.
And this doctor never apologized, never even addressed it. And I was so astounded by that. And so, yeah, I mean, that's what I'm saying is that it's really hard sometimes if you go in and you're trusting your doctor, which we want to do because they are the professionals, right? But helping them understand that it is okay for you to use your voice and say,
Mm.
I would like to get a second opinion, and go get a second opinion, because that's exactly what Coma did. And she figured it out, but not until it was stage 4. So that's what, she's dealing with because of this doctor. Yeah,
Yeah.
very heartbreaking, and it
I mean,
pisses me off.
it that's inexcusable. Like,
Yeah,
you might give a little bit of pushback or an explanation of, hey, the odds of this being something serious are so low right now. Like, you're so low risk, blah, 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 blah. Let's keep an eye on it. Like, call me back in 6 weeks if this isn't. But to just like continue to push it off or to not give that person a fresh set of eyes, I don't have anything for that. We're human. We as physicians are human, right? Just like anyone else. We're super highly educated and probably perfectionistic, type A, wrapped around the axle, rosebush up our asses, shitting diamonds. Like, okay, I get it. But we make mistakes and we cannot possibly know it all. And being in medicine is constantly a learning process. Like, I mean, I think that's one of the reasons I went into emergency medicine was that I like the unknown. I like the spontaneity. I don't want someone to hand me a list. These are the patients you're going to see today in your clinic. Like that to me makes me want to just vomit. It's like I like the adrenaline rush of it all, but part of that is being surprised, being shocked, learning new things. And I think as physicians and providers, it's easy to get into ruts of, well, I've never seen that before, and so it doesn't exist. That's totally not true. And that's really not how you should practice. And frankly, breast cancer and colon cancer and asthma and allergies are all getting worse with time. Like the science, I don't know what's going on. I don't know if it's antibiotics in the chicken. I have no idea why those four issues continue to get worse and worse as the science should be getting better and better. But that's where we're at right now. And so, brushing people aside when they have those concerns does not make any sense. And frankly, I'm going to bring up insurance companies. They should pay for
yes.
that shit
Yeah,
because, right? Like paying for someone to get over stage 1 breast cancer or like paying for them to snip out a couple of polyps and have another colonoscopy in 3 years is a hell of a lot cheaper and more efficient financially than dealing with stage 4 breast cancer or dealing with someone with stage 4 colon cancer. Like, what are we doing? None of this makes sense. The
none of
patient
it.
is the one who pays the ultimate price. But if you're going to be greedy about it and look at the bottom line, it fucks up your finances too to
Mhm.
not be working with people to get the answer earlier.
Yeah, and that's which brings me up to another barrier are the insurance companies and their denials. And I had my first experience with a denial when I right smack in the middle of my breast cancer treatments. I had developed this really rare anemia and it came out they think I'm pretty sure, I'm certain actually, because I did go get a second and a third opinion when they were doing all my scans, they found this other tumor that was in my thoracic cavity. It was a thymoma tumor, and it was big, and it was sitting up against my heart. And I'm like, well, shit, how would I even have known about the? And it was benign and encapsulated, but I was like, how would I have ever have known about this tumor had I not gotten breast cancer? And they're like, you wouldn't unless it
You wouldn't.
all hell broke loose and it became malignant. And so what happened is that tumor was emitting antibodies that were attacking my red blood cells as they were being produced when I was going through chemo. And it created this anemia where my oncologist actually thought it was an iron deficiency, and she kept telling me to go home and eat a big steak. And I'm like, and at the time I was sort of more vegan and like, I don't want to eat a big steak. And she said, you need to go eat a big bloody steak. And so, but it turned out that it was not an iron deficiency. But I kept on having to go to the emergency and to, that infusion center or Renown Infusion Center and get these blood infusions. And so I got this letter in the mail that denied my infusion. And it turns out that they just assumed that it was an iron deficiency. They said that it was not life threatening. And in fact, it absolutely was life threatening. And so the doctor had to, send a letter back, and I was able to get it covered. But it turned out that it's called, oh my God, what was it? It was aplasia anemia. I can't remember what the whole
Mm,
name was, but it was,
aplastic anemia.
yeah,
Yeah.
it was yeah, and I found out through UC Davis, and then also another doctor that was recommended to me, and he is the one that had suggested that I get on, oh God, what was it called? I see I've put it all out of my mind because it was such a crazy situation, but I was on this medication for quite some time just to get my blood levels back up and my hemoglobin back up. But I had dozens of blood transfusions, and I called them infusions, but transfusions. But because I had the antibodies, every time I went in, they had to test the bloods and get it as close as
Yes.
possible so that I didn't get an allergic reaction. And everybody kept on calling in saying, "Hey, I'll come down, I'll give blood," because I'm O positive. I'll come give blood. And I said, it's not that easy. They can't just take anyone's blood. So sometimes I had to wait for
Yeah.
days at a time to get it approved. It was like I learned so much about insurance and the whole system. But that's the biggest thing, is that insurance. Why are we being denied for certain things? Like if you have breast cancer, why are we being denied for chemo? There I know people who've been denied for that. I
Yes.
because these insurance people, I watched a documentary years ago that had these people who used to work for the insurance companies. They said, yeah, when we get claims that come in, we're trained to actually deny first. So therefore, I now have two or three people who are in my back pocket. If somebody sends me a message and says, "Hey, I was denied for blah, blah, blah," I can actually reach out to them and say, "Okay, how can they appeal this?" And the idea is
Yeah.
to use the language that the denial letter says, to go back and write the letter and appeal it that way. And so I always encourage people, hey, if you get denied for something, don't just say, okay, they just denied it. No, 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 no. You need to appeal that denial,
Yes.
regardless of
That's
whether it's going to
absolutely
go through or not.
true.
Yeah. So, but that's that other
And the people who
barrier.
are doing the denials, they're not physicians. They're not
No.
healthcare providers. They are there to be a barrier, essentially. They're clerical. They have some training in what they're doing, but they're not in the medical field. And so no wonder they looked at your, numbers and were saying, you don't need a transfusion. We're not going to pay for that. Especially since you needed specialized transfusions because you had the antibodies. And so it's way more expensive to like do all the testing to get you the blood that you need so that you don't have an allergic reaction. Um, to the transfusion, like it's a lot more expensive for you to get a transfusion than for most of us, right? And so, yeah, of course they're going to be like, "Oh, we don't want to pay for that. That was way too expensive and her numbers aren't that bad." But they're not medical professionals to look and go, "Why the heck does she need this in the first place? Let me look
Well,
through the
yeah. And I didn't even know there was any such thing as any other kind of anemia other than iron deficiency. So they probably don't even know that.
Right.
Yeah.
Aplastic anemia, they're not going to be like, "Oh, well, of course, this is, immune mediated." They're not going to have any idea because they're not hematologists, they're not oncologists, they're not even physicians. And
Yeah.
so they are
I know
literally
way more
there
about it
just to
now.
push back.
I could do a whole TED talk on it.
That's right.
Like I really, by the time I got done with all that stuff, I was like, but as you noticed just a few seconds ago, it's like I put it out of my mind. Sometimes I can't even remember anything, but I do attribute that to a little bit of chemo brain. They do say that chemo brain is real and it does last. So sometimes I can't even come up with the words anymore. Well, I just think that, having someone out there like you with your expertise and your personality and, just your overall interest too in making sure that we find things out. If you don't know something, you strike me as the type of person to go find out learn about it and, help advocate for people. How do people reach you? Like, I would love for people to be able to reach out to you if they need any kind of services or if they want to listen to your podcast or all the things. Tell us all the things.
Well, my website is drcarifffs.com. So DRCARI, which is my name, and ffs.com. And that has all my socials. On all of the pages. You can book an appointment to see me. And again, I'm licensed in 15 states, so I can see a lot of people outside of my home state of Nevada. Um, and most of the stuff I'm doing is hormone stuff for all genders, actually. But I've had a lot of people who just say, like, I've had all this testing done and I can't get in to see anybody to go over the results or what the plan should be. Can I just give you all that stuff and have a conversation with you? Heck yeah. That's
Love
what I
that.
used to do at Grand Rounds, which I absolutely loved. It's kind of detective work, which I dig. And so they'll just like get on my system, make an appointment, upload all of their studies and labs, and book like a 50-minute appointment with me. And I'll go over every single thing. What does this mean? What does this say? How do I even pronounce that? Why did they draw this? Is it low? So now what do I do? And so I can really be a good consultant in that way to just kind of do a care coordination. It's weird because in the emergency department, we ended up doing that quite a bit because we might see somebody who has been seeing their general practitioner, saw a specialist, got a bunch of studies, and now they can't see anybody for like 3 months because everybody's understaffed, right? And they're freaking out and panicking because there's a bunch of language and, you know, red letters and arrows and stuff like that. And they're like, what the heck is going on? I can't live like this for another 12 weeks before I see my primary care provider and get an answer. Yeah, okay, well, let's go over that. And that's not a great use of the emergency department at all.
Right.
But if that's your emergency today, I'm going to do what I can. And I love that kind of detective work. And so you're right. And I've been working here for so long that I have so many specialists that I can just like, kick them a text message. Hey, what do you think about this? And that's another thing my girlfriends and I used to do all the time, and we still do. Like, hey, who's the best knee guy in town? You know who to ask about. I need a new knee. I need a new hip. I have a lump in my boob. What am I supposed to do? And so we're really good about ferreting out how to get that information because I know I don't have it all. I'm not expected to have it all, but I will find the people who do have it all.
So if somebody were to ask you, being Breast Cancer Awareness Month, a lot of people get their mammograms, all their screening done in October just because it is October. And that I used to, and because it was my birthday also, but then it changed during COVID. If somebody were to come up to you and say, look, I don't know what to do. I have a lump. Something doesn't seem right. I don't even know where to go. I don't have any insurance. How can I get, you know, what would you tell them?
There are plenty of screening opportunities throughout town, and I'm sure in most places. And so they'll have drives where it's like, hey, this week we're going to have the trailer at blah, 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 blah. And they'll have a certain amount of appointments for that. I know you have to get on it early because a lot of people use those resources, which is awesome. But you can get on waiting lists, you can get on cancellation lists. And I love that it's Breast Cancer Awareness Month, but frankly, I was like, I don't want to swim through all the people in October. I'm just going to do it in February. I don't know why I chose February, but that's my month. So if you do have a lump, then that's the other thing people need to understand is there's screening where you just do like the 6 squishes and they just kind of look at it and see what that looks like. That's for people who are not experiencing any concerning symptoms. So usually, you start in your mid 40s, depending on what your family history is, and you just do a screening. If you have a lump, or your nipple looks weird, or your skin on your breast looks weird, something where you're concerned about it, then that is a different test. That's a diagnostic test, meaning you're looking at it way more closely. And oftentimes they'll do an ultrasound of the breast after they do the squishing of the particular concerning part. And so you probably do need to have a practitioner order that for you. Sometimes you can do that via telehealth. You can also go to Planned Parenthood. They are freaking amazing and they
Love
follow
them.
up on everything, and I do love them so much. And those are some resources that you can use if you can't get into your primary care person in a timely fashion or if you don't have one. So I would say if you just need a screening, go through Planned Parenthood, or you can go directly to the resources that have the vans that go all over the place. But if you have an actual lump, then I would hit up your primary care provider, your gynecologist, or Planned Parenthood to have somebody feel that with you and then order the appropriate test.
Right, and then they can lead you into the direction that you need to go to. So, if you are out there and you feel a lump or something seems off, the visuals of your breast, Planned Parenthood, you can even call probably Renown and they would be able to help, guide you to a resource that can help you if you don't have insurance or whatever it is. I don't know if I told you, Dr. Cari, that I'm a lemonista. Do you know what a lemonista is?
No, tell me.
Oh, well, let me tell you. So I am partnered, Test Those Breasts is partnered with an organization called Know Your Lemons. And Know Your Lemons was started by this wonderful gal named Corinne, and she is a doctor. And she was interviewed on my podcast, probably, I think it was like last year. One of her best friends died of breast cancer, and she really went on a mission to help people know your lemons. And she used lemons instead of breasts for the visualization. And people like me can come in and they can, they go through a little quiz, learning about, how to recognize breast cancer and become certified to become a lemonista. And I teach breast cancer classes for free. I mean, if people want to learn the 12 signs of breast cancer, and I also break down the myths of breast cancer, one being that you're going to get breast cancer if you have it in your family only, which more people who get diagnosed with breast cancer don't even have it in their family, a larger percentage. I didn't have it in my family and I don't. And the percentage of men that can get breast cancer. And so I teach breast cancer classes. So that's what we should do is we should get a bunch of people together and I'll come and teach a breast cancer class. And it makes it kind of a fun way to recognize the visuals of what to look for, but also on top of that, not just feeling around your boobs isn't enough. We need to make sure that we're going around into our lymph nodes and even know where your lymph nodes are. And so I actually teach people how to do that as well. So I'm a lemonista and
My
we're all over
goodness.
the world. We are all over the world. And so it's really fun. So seriously, we should get a group of people together so that I can do that. Well, I just really love our conversation here, and I think that we're going to continue this conversation down the road. I'm going to be on maybe your podcast or go live with you at some point soon, and I will put all of your contact information in the show notes. And I just love this conversation about breast cancer and healthcare and insurance and sexual health. And is there anything else you'd like to leave us with before we disconnect today?
Jamie, you are a total gem. I'm so glad that you have been dropped into my life. You bring a lot of positives in a pretty dim place right now. And so I just want to extend my appreciation. You're really holding up a lot of pillars and providing a lot of dark times.
Well, thank you very much. And I feel the same way about you. I feel like, uh, people are brought into our lives for a specific reason, and people are magnetic. They really come together and they recognize that they have something to share with each other. And I really am grateful that I got to share that with you. So thank you. And I will be seeing you very soon. And to my audience, thank you for tuning in again on this episode of Test Those Breasts. Dr. Cari's information will be all in the show notes. And until next time, we will see you next time on the next episode of Test Those Breasts. Bye for now.
Thank you, Jamie.